I remember the first time hearing the talk of the worried news anchors on my local news channel. The major Ebola virus outbreak that originated in Africa, yet slowly made its way to the United States, where several cases opened and frightened us all. We knew the possibility of it coming to a city near you, to a person near you, and contaminating you or someone you know. It was scary, and it was the very first time in my life that I remember being fearful of a deadly outbreak across our nation. The virus, however, ran its course and, like any other major news topic, died down and went on to the next catastrophe after a couple of days. But for those who were affected by the virus, it did not die down or go away. Actually, the virus still portrays lasting complications for those who were considered contaminated several years ago by this major sickness. Today, I'm going to talk to you about the challenges these individuals face today and the importance that this outbreak had on our country by covering the ideas of how many people total were affected by the Ebola virus, the long-term health effects of the virus, and the psychosocial effects of the outbreak at individual, community, and international levels. According to CNN Fast Facts on the Ebola virus in the United States, there were only 10 cases, with one leading to death of the infection. However, the CDC states the number of cases and deaths the highest in African countries, the most being in Liberia, where there was 10,675 cases, 4,809 deaths. In fact, one case that was present in the United States originated in Liberia. Another originated in Guinea, where 3,811 cases were opened there that led to 2,543 deaths. This was the third highest country for open cases and deaths of the virus. The other two cases in the United States originated within our country. There were organizations like the AIDS organization, which deployed more than 5,300 staff members to fight the epidemic. 28 contracted the virus, and 14 died. Overall, more than 500 healthcare workers have died during the outbreak. That was a quote from the CNN Fast Facts. So not only those who were contaminated from the not-so-confident known source of fruit bats, but the thousands of healthcare workers who went to help those in need lost their lives as well. The first case of the Ebola virus was found in 1976 in an African country. The virus stayed prominent there for years, leading up to 2014, when people around the world began to hear about the virus. During that time span, I can't help but to think if there was research that could have been conducted by the CDC to help those small African countries of ridding of the virus before it got out of hand like it did in the years of 2014 to 2016. Next, I want to talk to you about the long-lasting health effects of this virus, of the Ebola virus. Nancy Wright-Bull, a survivor of the virus, which was the outbreak in the United States, shares her experience when she found out that she was infected. She says there's vomiting, there's diarrhea, there's weakness, there's a fever, there's a rash, and it just attacks the body and begins to attack your organs. And as the disease progresses, a lot of people do bleed out. She quoted that to CNN in 2016. Wright-Bull goes on to say that she constantly holds a lingering pain in her joints from the once infectious disease that overtook her body. Wright-Bull was one of the first Americans to be diagnosed with Ebola and was evacuated to the U.S. after her missionary work dealing with Ebola patients in Liberia, where she caught the disease. Once she was considered infected, she spent 2 weeks in isolation at Emory University Hospital in Atlanta. Wright-Bull and her husband believe that she played a major role in bringing this health epidemic to the rest of the world's attention. Once they were diagnosed, the world began to realize that the contagious virus could spread beyond Africa and into U.S. soil, and that something needed to be done about that. CNN goes on to say that doctors believe that those who were previously diagnosed with the Ebola virus are now immune to this sickness, so there should be no fear of those who were sick years ago getting sick again. although this does not mean that they aren't experiencing horrific side effects years later. Some stated that they experienced mild effects such as a bad cough, aching joints, sore muscles, and muscle spasms. And then there were cases where some experienced more severe side effects such as blurry and loss of vision. Dr. Ian Crozier was by far the sickest Ebola patient to arrive at Emory University Hospital in Atlanta. He was placed on a ventilator and underwent kidney dialysis. He spent 40 days in the isolation unit. Less than 2 months after being discharged, Crozier started experiencing problems with his vision. He returned to Emory, and his doctors were stunned to find traces of the virus and fluid from his eye. They were even more surprised to watch as his eye turned from its original blue color to a greenish color. He quoted that to CNN also in an interview. It is instances like these that make you put into perspective how unfortunate their lives were to have caught the virus, and even now because they truly aren't able to get over the disease when there are side effects like these involved. Another point that I would like to discuss is the psychosocial side effects of the Ebola virus. And they may still be experiencing these things today. Some survivors were threatened, attacked, evicted, left behind by, or excluded from their families and communities because they were seen as tainted and dangerous. A quote from the World Health Organization says, a CNN report states that when interviewing Ian Crozier, an Ebola virus survivor, he tells us that it took a while for people to get near him again, even after the virus was out of his system or he was declared safe to be in the public again. He says, I've only had a few instances where strangers steered clear of me or didn't want to be near me. Unfortunately, some others, both in the U.S. and here in Africa, have been badly stigmatized and are struggling to put their lives back together. On top of having to be isolated for weeks upon end, the stigma of being sick, deadly, and unwanted to be around has to make a person feel nasty. The lasting health effects are enough to have to deal with. I can't imagine having to worry about people not wanting to be near you years later. Out of the 10 open cases of the Ebola virus, 8 people are lucky to have survived and overall are in okay shape. However, the health effects, psychosocial effects, and the overall burden it has put on their lives is something to empathize. I only hope that the world has seen what an epidemic this has caused and precautions are now in place to make sure that there isn't another disease that could have had such an outbreak like the Ebola had on our world and on our people. Thank you so much for listening.